My name's Crystal. I'm a speech-language pathologist from Calgary, Alberta in Canada. And I'm here to tell you guys about a concept that we piloted, myself and the dietitian from our clinic, that we called the Eating and Nutrition Support Group. So it follows nicely from Dr. Plowman's presentation there. So I just wanted to tell you a little bit about our clinic first. We're from Alberta, as I said, and we cover quite a big area there, all of southern Alberta. We have approximately 155 patients, and we have 2.5 clinic days per month. And we have a full medical team, so the neurologist, respirologist, palliative care physician, all of the allied health members, nurses, dental hygienist. So we don't really have a lot of time in clinic, about 20 to 25 minutes per patient. And the dietitian and I often work together on our assessments and treatment plans. So we're really trying to maximize on our time and be really efficient. This is a picture of our facility there in Calgary. And we're hoping that that's all covered in snow right now while we're here in Florida. So this is just an idea of what I'm going to be presenting today. So the background on this project was that we saw a need in our clinic. As Emily had said at the beginning of her presentation, these patients that we see, approximately 25 to 30% of them are going to be the bulbar onset, which may or may not include the dysphagia. And that doesn't take into account those people who have reduced appetite due to a number of reasons, and then self-feeding difficulties, which can really affect overall quality of life. If you're not enjoying your food or eating or the eating experience, then that can really change how you socialize. As we all know, we often invite our friends over for drinks or invite them out to go for lunch, and if you no longer enjoy that experience, then you're gonna isolate yourself from those activities. So Tiffany and I really saw a need in our clinic to try and improve that experience with eating, and so we thought we'd develop this program. So some more background here. We wanted to provide a space outside of clinic. So when they're in the clinic room, it's kind of out of context. You're giving them recommendations for what to eat, how to eat, and you're not in that environment, and there might not be as much buy-in or behavioral change. So we wanted to provide an environment that kind of mimicked the eating space. And we know that support group format is often good for these patients. They can get together and discuss what works, what doesn't work, and talk to each other. Oops, what did I do here? There we go. So what did we do? Tiffany and I collaborated and created an environment where we could invite patients and caregivers to be supported and normalized in their eating struggles. We provided demonstration and strategies as well as education to the patients, and we called it the Eating and Nutrition Support Group. So this is might be a little bit unique to our facility. SHC stands for South Health Campus. That's the hospital that we work in Calgary. And we have a wellness kitchen within a wellness center on our main level of the hospital. So you can see that it's set up quite nicely. It's wheelchair accessible. They offer a number of different cooking classes and programs for all sorts of, for inpatients, outpatients. The dietitians do a lot of that work in our hospital. So we really do have a great environment and the opportunity to offer this at our hospital, which may not be available to everybody. So we're excited about that. So some details about the actual support group. We offered 4 one-hour sessions. We invited both patients and caregivers, and then we had 4 session themes as listed here. We had patients all stages of the disease. Some had dysphagia, some didn't have dysphagia, some had G-tubes, some didn't. We had about 4 to 8 participants per session. and 8 was about the maximum. As you can see, the space wasn't super large. Within the classes, we provided demonstrations, so we're able to actually prepare food for the patients and modify the textures as needed, providing strategies, and then we really wanted to emphasize the taste and the pleasure with eating. So just because you might be on a pureed diet doesn't mean you have to eat terrible food. It still can taste really yummy. We gave food and drink samples throughout our sessions. We provided handouts, and we really encouraged conversation amongst the patients, whether they were verbal or nonverbal. And we did have patients who were using written communication devices, and they all participated, which was really cool. So just getting into some of the education that we provided during our sessions, providing the patients with education on if you don't have dysphagia, this might be what you would watch for, and this is for caregivers and patients. Okay. And then just further education, and some of this was impromptu. If the patients asked questions, we provided it as needed. And we really wanted to emphasize the pleasure eating in our classes. So even though we're making a recommendation maybe for nothing per mouth or, a pureed diet, we know that the patients still want to get some pleasure out of eating and will probably eat regular solid foods. So we want to find that balance between safety and their quality of life. And if you want to continue to eat a burger, a bite of a burger every once in a while, how can we allow you to do that but still be safe? So we did encourage that, but encourage that safety aspect of it as well. This is just a handout that I often provide. It's through our health system or health region, and just gives general information on safe swallowing. During our class, we talked about the different food textures and modification. So some patients and caregivers aren't aware that there's an in-between from regular food to maybe nothing per mouth or that G-tube feeding. So giving them that education on there's some steps before you go to just not eating or drinking. And so for example, in one of our classes, we prepared a chicken thigh with some sauce, so we showed it as its normal, in its normal form. We provided it as minced and then pureed and gave everybody samples so that they could see it. It still tasted very good. For the dietitian part, Tiffany talked about increasing calories and protein while still maybe eating the same amount, but how can we maximize on that calorie and protein intake if the appetite isn't quite there? And really encouraging the hydration in these patients as well. Talking about label reading, and that was something that one of our patients had requested from Tiffany. Talking about nutritional supplements, so it's not a first line of defense, but we know that some of these patients do need that little boost every once in a while, so we just gave examples and provided samples of different types of supplements that they might use. And then protein powders, we were able to actually give that demonstration within the classes of how you would make a slurry with a protein powder before just adding it into your soup to boost up that protein in everyday meals. This is an example of one of the handouts from our smoothie session. And so we had 2 different smoothies that day, a little bit maybe unusual for the average person, and we did have some people that didn't think that avocado smoothie would be very good, and it was delicious. We had Buyin. So I just wanted to point out we always used highest calorie and highest protein items where we could, and then Tiffany would provide examples of alternatives as needed. And then directions, we were able to actually demonstrate how to make the smoothies, and then if they needed to be thickened, how to do that as well. And then the calorie and protein information was provided to the patients so that they could see that. And we really tried to maximize. You can see there's some high calorie, high protein options there, which was cool. So our outcomes, we didn't do any kind of statistical outcomes, but we did provide written evaluations after each class for the patients and the caregivers to fill out so we could get an idea of what they thought. And we found that there was a theme of engagement and learning from each other and that strong supportive environment. And I'll just give you a few examples of some of the feedback that we got from the patients. So the first quote here was an email that we received after our class from one of our patients, which really hit home for us because that was our main goal. I'm getting to the point where I no longer want to eat or drink in public, but you have created such a warm, friendly atmosphere. And we really couldn't take credit for that. It was the group of patients and how they interacted with each other, and it was just a really cool thing to see. The second one was a verbal feedback that we got 2 weeks after our smoothie session. And the patient had said, you know, I've started drinking one of those smoothies every day in the morning, and I've gained 5 pounds. And that's not something we often hear from these patients, from oral intake only. So that was a real big win for us too, and for her. This is some of the written feedback that we received from the patients. And that interaction piece was a huge trend. We saw that over and over again in our feedback. And then that kind, supportive environment, learning how to increase calorie and protein intake. It was just a really cool way to see what we usually give individually in the clinic room, taken to the real world and put into practice. And I think that we got a lot more buy-in that way. So our next steps, we thought anyways, that this was a huge success, and we hope to continue to offer this program in our hospital. We do see that there were definite challenges to setting up subsequent sessions, somewhat due to the nature of the population. Sometimes it's hard for us to recruit the patients and get that commitment for them to come into the hospital. Alberta is a very big, oh jeez, it's dangerous. It's big. It's a big landmass, and we have patients that are out of town that definitely couldn't make it into the sessions, and even the city of Calgary is quite big, and like the lady was saying, in Chicago the weather isn't always nice. It's not always nice in Calgary either, so people aren't as eager to drive in the winter. So we are trying to brainstorm in our clinic how we can get that buy-in and commitment for future sessions. And then just time commitments from Tiffany and I as well. This was a big project for us to take on, a lot of planning and then a lot of prep time and that before the sessions. So we're trying to recruit some other colleagues to help us out with that as well. And we are hoping that our kitchen will get telehealth access so that we could provide the service to people in the more remote communities. It's ideal if they can be there at the hospital, but we know that that's not always possible. And that's it. Any questions?
Thank you. This is now open for questions.
Hi, I'm Rochelle. I work at the ALS Association of Oregon in Southwest Washington, and I was just wondering if you guys address alternative diets like gluten-free, vegan, vegetarian, or how you guys address that, if you did.
That's a good question. In this particular class or these sessions, it didn't come up, but Tiffany in our clinic definitely gets those questions and will address them as they come about. We didn't focus on it in these particular ones, though.